Welcome, everyone. Today, we will explore the complexities of healthcare in the United States, including its costs, disparities in coverage, and ethical issues. Despite being one of the wealthiest nations, the U.S. struggles with providing equitable healthcare access to all citizens. Let's look at the major factors affecting our healthcare system. The U.S. healthcare system is paradoxical. While we've spent more than any other country, our healthcare outcomes often lag behind. Many of the leading causes of death are linked to lifestyle and hereditary factors, rather than medical care access. Additionally, racial and economic disparities continue to create barriers to healthcare for millions of Americans. Throughout the mid 20th century, healthcare reform faced fierce opposition under the label of socialized medicine. However, in 1965, Medicare and Medicaid were introduced, offering government-funded healthcare to seniors and low-income individuals. While these programs helped millions, gaps in coverage still remained. As medical technology advanced and public insurance program expanded, healthcare takes up an increased share of the U.S. economy. Managed care arrangements and healthcare policies attempt to contain costs, but expenses continue to rise. Most Americans depend on employer-sponsored insurance, but the system leaves many uninsured, particularly those who are unemployed or in low-wage jobs without benefits. In the 1900s, President Clinton proposed universal health care coverage, but political opposition prevented it from becoming law. The Affordable Care Act followed, and following President Obama's election, health care reform returned to the nation's spotlight. So despite political turmoil, the Affordable Care Act passed in 2010. The Affordable Care Act significantly expanded insurance coverage, but has faced numerous attempts at repeal and legal battles. So healthcare, when we're talking about ethical dilemmas in healthcare, involves difficult ethical questions. From insurance probability to end-of-life decisions, policymakers and medical professionals must navigate complex moral dilemmas. For example, physician-assisted suicide is legal in some states, but remains controversial. HIPAA. Now, HIPAA protects patients' privacies and it ensures health insurance probability. It allows individuals to switch insurance plans when changing jobs and ensures that medical records remain confidential. However, the rise of electronic health records brings new privacy challenges. Healthcare rationing is a controversial topic. So with limited resource, how should we decide who receives care? For example, should life-saving treatments be prioritized for children over elderly patients? So these are some complex ethical debates that happen within our nation. Futile care is another one, and this refers to medical treatment that is unlikely to benefit a patient. Some hospitals refuse such treatment, but families often challenge these decisions. The debate raises ethical concerns, particularly in managed care systems focused on cost control. Now, euthanasia and physician-assisted suicide remains deeply divisive. It's a really divisive issue. And some argue that individuals should have the right to end their suffering, while others worry about potential abuses. So the law varies widely across different states and countries. So, in conclusion, the future of the U.S. healthcare system remains uncertain. Rising costs, coverage gaps, and ethical dilemmas, they will continue to shape healthcare policies. As technology advances as well, we must address new challenges while ensuring that all Americans have access to quality care.